Okay, let's unpack this. We are diving into a topic that is absolutely crucial, but, well, honestly, often gets overlooked, kind of pushed aside.
Yeah, definitely.
We're looking at women's health and specifically the global crisis many women are facing right now. We've got a stack of recent reports and studies here.
That's right. And it's pretty staggering when you stop and think about it. Women make up almost half the world's population, right? Over 4 billion people.
4 billion.
Yeah. And the scale of the health challenges they face, challenges that often get ignored or downplayed, it's huge.
Yeah.
These reports from 2024, 2025, they lay it out in really stark detail.
And our mission for this deep dive, it's, to get beyond just reading these documents, we really want to pull out the most important pieces,
Hmm.
understand just how many women are navigating, well, sometimes life-threatening situations, explore the complex reasons why, and really grasp the real-world impact. It goes way beyond just the headlines.
Exactly. Because as the sources really make clear, this isn't just about numbers on a page, is it?
No, not at all.
It's a fundamental human issue. It affects families, communities, economies, everywhere. So we're going to try and cut through the noise, bring you the essential insights from all this material.
What's particularly striking looking across these different sources is how consistently they highlight that women's health isn't simply a medical issue. It's deeply intertwined with societal norms, expectations.
Right. Systemic inequities, too.
Yeah, exactly.
The sources detail how the pressure on women to juggle so many roles, caregiver, professional, homemaker, it just takes an immense toll. There's a 2024 UN Women Report, for instance.
Okay.
It found that globally, women spend, get this, 2.5 times more hours on unpaid care work than men. And the sources link this directly to increased stress and, well, related health problems.
So this kind of multifaceted burden means the health challenges aren't just biological, they're actually shaped by the environment, the world women navigate every single day.
And a massive, persistent barrier the sources identify is simply getting access to quality healthcare. Just getting through the door.
Right.
Globally, the sources tell us 1.2 billion women lack access to essential health services. That's from a 2025 WHO report. Just think about the scale of that for a moment.
1.2 billion, it's hard to even wrap your head around. And in low-income countries, the situation is particularly stark, isn't it?
Oh, definitely. A 2024 study from the Guttmacher Institute, they focus on sexual and reproductive health research.
Right, I know them.
They found 75% of women in those countries report significant delays in getting care. Why?
Huh.
Cost, distance, even cultural stigma around seeking help.
75%.
Wow. But it's not just a problem, over there.
Yep.
Even in high-income countries like the U.S., the Kaiser Family Foundation, a big health policy research group, reported in 2024
Okay.
that 12% of women were uninsured. So 20 million people.
Mhm.
And that directly limits their ability to get critical, potentially life-saving screenings.
Yeah.
Things like cervical cancer screenings.
Okay, so let's look at some of the specific physical health challenge that the sources detail. Because numbers here, they really point to what some of these reports are calling a silent epidemic.
They really are eye-opening. Globally, for example, 10% of women, that's over 400 million, live with endometriosis.
Endometriosis.
For those who might not know, it's a condition where tissue similar to the uterus lining grows outside the uterus. Causes chronic, often severe pain, other issues too.
And the diagnosis time.
Shocking. A 2025 Endometriosis Foundation report points out it's often undiagnosed for, on average, 7 to 10 years.
7 to 10 years. Just that delay alone speaks volumes about how these issues are treated, doesn't it?
It really does. And then there's polycystic ovary syndrome, PCOS, a hormonal disorder very common among women of reproductive age.
Right.
It affects 1 in 10 women. That's roughly 116 million worldwide. And it significantly increases risk for things like diabetes, infertility.
Yet the diagnosis rate.
Well, a 2024 study in the Journal of Women's Health found 50% of women with PCOS remain undiagnosed. Half.
Half just missed.
See that pattern again and again. Cervical cancer is another tragedy highlighted in these sources. It's largely preventable, right, with vaccine screenings, but it still kills 342,000 women every year. And the WHO's 2025 data shows a staggering 90% of these deaths. They occur in low and middle income countries, largely due to that limited access we were just talking about.
Such a clear link. And maternal health is presented as another really critical crisis in these sources.
Absolutely.
In 2023, 287,000 women died during pregnancy or childbirth. Now, while that's a slight decrease from 2020, the sources make it really clear this maternal mortality ratio, the number of deaths per 100,000 live birth, it's still alarmingly high. And it shows huge global disparity.
It truly does. In sub-Saharan Africa, that ratio is 545 per 100,000 live births.
545.
Compare that to just 19 in high-income countries. The gap is just
And
immense.
even within those high-income countries, there are stark disparities. You look at CDC data from 2024,
Yeah.
it shows that in the U.S., maternal mortality rates actually rose to 32.9 per 100,000 live births in 2023.
Gross. Even here.
Yeah. And maybe most tragically, Black women were 2.6 times more likely to die than white women, which just highlights these significant racial inequities baked into the system itself.
So we've seen this enormous physical toll, but the sources make it clear these challenges aren't isolated, are they? They cast a really long shadow over women's mental health, too, often made worse by the very struggles and societal pressures we've already touched on.
Absolutely. The American Psychological Association reported in 2025 that women are 1.5 times more likely to experience depression and twice as likely to suffer from anxiety than men.
And the sheer scale globally is just immense. 1 in 5 women, that's about 800 million people, experience a mental health disorder annually.
800 million.
And terrifyingly, the WHO stated in 2025 that 80% of these women in low-income countries lack access to any care. 80%.
Just left struggling. Even here in the U.S., NAMI data, that's the National Alliance on Mental Illness from 2024, shows 22% of women reported a mental health condition, compared to just 15% of men.
And the sources directly link this back to those societal expectations we mentioned. A 2024 Pew Research study found 70% of women feel pressure to do it all. Manage work, parenting, households.
The juggle.
Exactly. And the sources connect that directly to burnout and increased mental health strain.
Trauma is also a huge factor discussed, and the sources provide some stark numbers there.
Yeah, they do.
A 2025 UN Women report found that 1 in 3 women globally, that's 1.3 billion people, experience physical or sexual violence in their lifetime.
1 in 3.
And this experience is frequently linked to triggering PTSD, depression, or anxiety.
And here in the U.S., the VA reported in 2024 that 46% of women veterans reported military sexual trauma, which doubled their risk of mental health disorders compared to those who didn't experience that.
46%. These sources really highlight how the systemic barriers we talked about earlier just amplify all these challenges, creating what feels like a broken system for so many women trying to get care.
Yeah, one pervasive issue identified across the sources is the dismissal of women's pain and symptoms, just not being believed.
Right.
Multiple studies cited show women wait longer in emergency rooms than men, up to 16 minutes longer, according to a 2024 Journal of Pain study. And they're 20% less likely to receive pain medication.
16 minutes longer, less likely to get pain meds. And you see story after story, don't you? Like anecdotes highlighted in a 2025 X post thread, the source mentioned, where women were told their severe symptoms were just stress or just anxiety, only to later find out they had really serious conditions, sometimes advanced cancers or severe autoimmune diseases.
Yeah, the source even included this powerful anecdote. A woman in rural India travels 6 hours for severe abdominal pain. Sent home by dismissive doctors, no tests run.
Oh, no.
Later finds out she had advanced endometriosis, needed surgery she couldn't afford. And these aren't isolated incidents, The sources present them as evidence of this pattern, not listening to women, not taking symptoms seriously, across all sorts of different healthcare settings.
And access to reproductive health, that's another significant hurdle detailed in these sources.
Huge one. Globally, 218 million women of reproductive age lack access to modern contraception. That's according to a 2025 Guttmacher report.
218 million? And the consequence.
Leads to 111 million unintended pregnancies every year.
Wow. And in the U.S., the situation around abortion access.
Yeah, the Center for Reproductive Rights stated that post-Roe v. Wade restrictions starting in 2022 have resulted in 21 states having severe abortion bans or restrictions in place as of 2025.
Which forces women to travel, often hundreds of miles, for care, or risk their lives with unsafe alternatives.
Exactly. And a 2024 JAMA study even found a 24% increase in maternal deaths in states with abortion bans since 2022. A direct link between restricted access and worse health outcomes.
24% increase.
It's easy to get lost in all these numbers, isn't it? But these sources consistently, powerfully bring it back to the human cost.
Yeah, they do.
These statistics represent real women with families, friends, dreams that are being impacted or even cut short.
The emotional toll, too. Chronic illness, persistent pain, and then the societal judgment or dismissal they face. It's immense.
Definitely. A 2025 survey by the Global Fund found 60% of women with chronic conditions like endometriosis report feeling isolated,
60%.
and 40% reported losing jobs or facing employment discrimination because of health-related absences.
It impacts relationships so deeply as well.
Yeah.
And AMI data from 2024 shows 30% of women with anxiety report significant strain on their marriages or partnerships.
Women are losing their quality of life, their livelihoods, and sadly their futures to conditions that are often preventable or treatable if they were just addressed early.
Think about the ultimate personal cost. In 2023, 4.4 million women died from non-communicable diseases, NCDs, things like cancer, heart disease, diabetes globally, that's WHO data.
4.4 million.
And so many of those deaths could have been prevented or managed with early intervention. But women face these barriers to diagnosis and care.
In sub-Saharan Africa, 1 in 22 women faces a lifetime risk of maternal death. That's UNICEF's 2025 data.
Yeah.
Often leaving children orphaned, families devastated.
It's gut-wrenching. And in the U.S., the CDC reported in 2024 that 1 in 5 women with postpartum depression, that's depression after childbirth, affecting about 600,000 women annually,
Right.
they go untreated. And 20% of those untreated women experience suicidal ideation. These are not just statistics. They're human stories demanding our attention and action.
Yeah. The sources also offer some critical reflections on the gaps in how we usually talk about women's health. It's often framed as this niche issue, only relevant to women.
And the sources really push back hard on that, highlighting its massive societal impact. When women suffer, families suffer, communities suffer, economies suffer too.
Definitely.
Yeah.
Oxfam, they focus on poverty, reported in 2024 that women's unpaid care work globally is valued at an astonishing $10.8 trillion.
Trillion.
Ignoring women's health has direct, massive economic consequences.
And data gaps still persist, right? Particularly in low-income regions.
Yeah, the WHO says only about 60% of maternal deaths are even officially recorded there, which obscures the true scale of the crisis. We don't even fully know how bad the problem is in some places.
Another really important point the sources make is that the focus on reproductive health, while absolutely vital, sometimes unintentionally overshadows other critical health issues for women, like heart disease.
Right, which is huge for women.
It is. The CDC 2024 data points out heart disease is actually the leading killer of women in the U.S., claims 1 in 5 female deaths. So it's crucial we look at the full spectrum of women's health needs.
So, okay, what can be done? According to these sources, they collectively suggest, a call to action on multiple fronts.
Okay.
It starts with talking about it, just like we're doing now. Sharing these stories, these facts, it's critical to breaking the silence and reducing that stigma.
There was a 2025 X campaign mentioned, #HerHealthMatters. It saw 1 million shares of women's health experiences globally. The sources highlight that as real evidence of the power of public awareness, of shared experience.
Yeah, that's powerful. We also need to demand accountability from healthcare systems, from governments.
Right.
The sources point to initiatives like the U.S. Maternal Health Omnibus Act of 2025, highlighted by the Congressional Black Caucus. It aims to invest $1 billion in Black maternal care. That's presented as a necessary step forward to address those disparities we talked about.
And supporting organizations doing the crucial work on the ground seems key, too.
Absolutely. The Global Fund, we mentioned them earlier, delivered care to 23 million women in 2024 alone. These organizations are really on the front lines.
Education within communities is also vital, the sources say.
School programs on women's health, piloted in 10 U.S. states in 2025, reportedly reduced stigma by 15%. That's according to Guttmacher. Understanding these issues early can really change perceptions and encourage people to seek help.
So this whole deep dive into the sources, it really just underscores that the struggles women face accessing healthcare, being properly diagnosed, being treated with respect, they are incredibly real, widespread, and frankly, urgent.
Yeah, the numbers: over 400 million women living with endometriosis, 800 million facing mental health challenges annually, hundreds of thousands dying every year from preventable maternal causes.
It's overwhelming.
It is. And they aren't just statistics. They reflect these deep-seated systemic failures, societal barriers, biases that desperately need addressing.
By shedding light on these issues, through the lens of these reports, hopefully we can contribute to that call for better care, more focused research, and ultimately true health equity for, half the world's population.
Because it's not a niche problem, is it?
No, it's a fundamental human issue. It impacts every single one of us.
Thinking about everything we've covered here, the long diagnosis times for conditions often dismissed,
Mm-hmm.
symptoms being put down to just stress, the heavy toll of societal roles, trauma, systemic biases in care.
Mm-hmm. It all adds up.
It does.
Which kind of raises an important question, maybe for you to consider as you process all this information. Given how frequently women's health issues are brushed aside or directly linked in these sources to their societal roles and experiences of trauma, how might addressing those underlying social and systemic factors be just as critical, or perhaps even more critical in some cases, than purely medical interventions when we think about tackling this global crisis?
That's a really key question. And the sources themselves, they do point to many places where you can learn more and engage further. They specifically urge a deeper exploration into women's mental health, which we touched on, but that could easily fill a hole in their deep dive.
Absolutely. Keep digging into important topics like this one. Understanding really does make a difference.